Okay, good morning, everyone. I'm Sandra Azakar, President of Alberta Union of Provincial Employees. Thank you for coming today. Today, I am actually joined by the Nursing Care Bargaining Committee. I'm going to start from my left. I have from Local 43, which it covers the North Nursing Zone. I have Sandy Miller and Jennifer Power. Right next to them, I have Local 44, who represents the Central Nursing Care, Mark Miller and Jesse Phillip. Nope, there she is, okay. Local 45, Calgary Nursing Care, Nancy Burton and Angela Smith. Local 46, Edmonton Nursing Care, Marty Roy and Heather Stewart. And I'm also joined by Kate Robinson, who's the lead negotiator for this table. Today is a pivotal day in the history of our union. Today, our nursing care members have spoken, and they have spoken loud and clear. They have had a tough and strong decision to say enough of the disregard of the value of the work that they do on behalf of Albertans day in and day out. AUP members today are united, organized, and ready to fight for better wages and safer working conditions. During the last weekend, we had a strike mandate vote, and I'm here to announce that 98% of participating AHS nursing care members voted yes to strike. An overwhelming number. These results are unofficial and still need to be certified by the Alberta Relations Board, but they voted overwhelmingly in favor of strike action because they are fed up with stagnant wages and unsafe working conditions that hurts workers, patients, and Alberta's public health care system. We're ready to get back to the bargaining table. We meet with them again on November 6th, 7th, 8th, and 9th for mediation. Our members would rather do their jobs, but they are prepared to stand up for what they deserve and to take job action if necessary. The earliest that AUP members could serve strike notice is November 17, 2025, and we're ready for that. Every time that the government cuts corners or delays fair contracts is working families and communities that pay the price, and this would be the case. So we're hopeful that the government will go back to the table with an offer that our members would be able to accept on behalf of the membership. AUP members are essential to Alberta's public health care system. When we stand up for fair treatment, we're standing up for quality of services all Albertans rely on. And we aren't fighting just for us, but for all Albertans and to protect our public health care system as well. So I would like to open this up for questions that if you have any. Bargaining questions will be directed to Kate Robinson, the lead negotiator.
Around the corner. Is that okay? Oh my gosh, am I okay over here? Okay. Hi, Sandra. Morgan Black with Global Edmonton. I'm just wondering if you could also tell us how many members of the 16,000 participated in the strike vote.
You bet you. We had 15,647 eligible members, and 11,031 actually took part in this vote.
And obviously the teacher strike is still very fresh, the province using the notwithstanding clause. How does what happened with the teachers impact next steps for you? I know you still have to go back to the table on November 6th, but is that weighing on your mind, the province's steps that they took with the notwithstanding clause?
It always weighs on everybody's mind when a government decides to violate the charter rights of any working Albertan. So we're keeping a very close eye on any of that government interference in our right to strike. But we're confident that we're prepared to take action in the eventuality that anything like that happens. Our members are strong, they're solid, we're organized. AUP is ready for this fight.
Hi, Lisa Johnson with the Canadian Press. You say that the notwithstanding clause weighs on everyone's mind, but it sounds like the main sticking points here were wages and safer working conditions. I wonder how much the notwithstanding clause has factored into your members' decision, or was that aside from why they voted this way?
I think we're focused on the issues that we've been at the table with for the last 18 months. And that has been our main focus. But again, I think any time that we have governments that violates the most basic rights that we all have as workers, it's always something that you have to consider. But I think this vote sends a very clear message that what they tried to do to the teachers, it wasn't necessarily a tactic that works in terms of scaring workers into taking action for themselves and for the services that they provide, healthcare in this case.
And I'm also wondering, I understand LPNs are part of this group and healthcare aides. I'm wondering if you can break down how your essential services agreement will play out in the event of a strike. What are the practical impacts on the ground for patients in various facilities, and where might we see striking healthcare workers affecting services?
For sure. I will let Kate Robinson answer that question, but just so that you guys have an understanding of who we cover under this sector it's also rehab care workers, mental health aides, psychiatric aides, client care assistants, physiotherapy assistants, operating room technicians, orthopedic technicians, personal support coordinators. So it's a vast array of workers that are essential in the healthcare system that they're going to have to do without in the event of a strike. Okay, so I'll let.
So with the ESA, there are schedules, staffing plans we call them. There's about 1,100 throughout the province. So we've been working with the employer to establish what duties are required in the event of a strike and the number of people to carry out those duties and when. The only thing is right now there's not names associated with those duties. And through our agreement, the employers will be scheduling members in the first week of a strike, and then the union will take over those scheduling duties. But we would anticipate that if there's a strike called, it would be province-wide, and there would likely be impact to the entire healthcare system. But of course, essential services will be maintained, so anything that affects life, health, or safety.
Rakowski, All Alberta. So you had laid out on the website sort of what you were seeking. I'm wondering how far apart are you and the employer at this point? What's sort of the sticking point?
Again, go ahead, Kate.
Well, unfortunately, we are very far apart. The employer is offering 12% over 4 years in terms of wage increases, and they even still have some rollbacks on the table, specifically to wages. And we are simply seeking wages that represent the work that is being done in the workplace by these healthcare workers. It's been a long time without any wage increases that reflect the scope of practice for both healthcare aides and LPNs. The government did settle with the United Nurses of Alberta earlier this year and gave them a significant wage increase, and that just puts our members even further behind. So we are unfortunately still far apart, but we've got 4 days coming up, November 6th through 9th, with a mediator. And I tell my committee they should pack pajamas. We are here to get a deal. Our goal is to get a deal. Our goal is not to find ourselves on the picket line.
And can you speak to the pressure of wages, the working hours you're working, the overall conditions in your workplace?
So AHS for a long time now has run with a vacancy rate of around 10 to 12%. It fluctuates, and so that's a pretty significant number. So these members go into work constantly being short-staffed. Alberta Health Services has relied on what we would call an agency nurse, and those are private contractors who pay a lot more money, pay the mileage, pay for a hotel, in order to fill those gaps. And so we know what it takes to be able to recruit, because those staffing agencies are able to recruit, and they simply pay more money. So our objective here is to ensure that when Albertans go to the hospital, the nursing care that they are entitled to is there for them. And we think that one of the quickest ways to do that is through wages so that these employers are able to recruit.
Hi, Sean Amato with City News. A question for Sandra. I guess how concerned are you that your members will go through this process only to be shut down by the government the way that they did with the teachers? And do you think that part of that move was to try to send a message to unions like yours that the government can just legislate you back to work anyway?
Well, I have no doubt that that was the intent of the government is to interfere with bargaining as much as they can, and to create an environment where we don't trust the employer. But as I said before, our union has been preparing for this situation for a long time. We've been in bargaining not only with nursing care, but also with the GOA and other tables that we're currently bargaining with. And we know the reality of the political reality that we're facing. And so I think they played that card. They showed their cards, and we're ready for anything that comes our way.
Other union leaders are now talking about the potential of a general strike in Alberta, of organizing towards that potentially. What do you make of that? What do you think about that? Would you be supportive of that? Would you want to join in on that?
Okay, right now, like I said, we're laser focused on what it is that we need to do for our membership. Those conversations are being had. We are part of those conversations, but right now our main focus is to ensure that our members get the recognition that they deserve and that they actually get what they have been needing for some time.
Emmanuel Prestovet, Radio-Canada. I just want some clarity on the Essential Services Agreement. What proportion do you estimate of your members will have to show up to work even though they're in a strike? Because you already said you're understaffed. So if you understaff the understaffing, then there's no services being delivered. So how would that work?
I was not involved directly in the negotiations for the Essential Services Agreement, but I believe that I think we'd have to get back to you with a number because it varies, right? Like some areas are 100% essential, others are 0%, right? So it just depends. Like the overall number, I'm going to say is around 70%, but I think we'd have to get back to you with a concrete number there. Sorry, what was the second part of your question?
Well, basically, how do you make sure that essential services are being maintained if you already plan to have fewer than few people?
That it's a good question because oftentimes, if you've got a work site with 10 people scheduled and 2 are on vacation and 1 calls in sick, then now you're short-staffed, and that is the essential services level in some cases. AHS is going to look after the scheduling. All members are available to pick up shifts during the strike to work those essential shifts. So hopefully we're able to fill in the gaps. But it's an excellent point to make that the day-to-day is sometimes below the essential levels. And that's problematic in terms of carrying out healthcare in Alberta. So that's, again, something we're hoping to address via these negotiations.
How would you say the government's reform or refocusing of AHS affected your working conditions in the last few years?
The chaos that currently our healthcare system is in is just that it's chaotic. I don't think anybody knows exactly what the lay of the land is, or who's in charge, or how the healthcare system will be impacted by these different pillars, and who ultimately will be responsible for the delivery of healthcare in this province. We have different ministries now that are involved, and so that adds an extra layer of confusion and unset. And basically our members are unsettled right now because they don't know what tomorrow will look like, and like I said, ultimately who's in charge.
Hello, Sarah Reed with CBC. You mentioned that the government has offered 12% wage increase over 4 years, and that's not something you guys are happy with. Do you have a number that you're looking for from the government? And as well, I guess to add to that, kind of where does Alberta sit in comparison to maybe some of the other provinces for people in your union?
I'll let Kate answer that specific question, but I just wanted to add something before. The majority of the members that we represent in healthcare, in this nursing care sector, are doing exponentially more work that is and their scope of practice has increased to the point where they're doing 84% of what RNs do, but only getting paid 60 some percent. And healthcare aides are constantly being asked to do more of the restricted activities as well, and they're also getting regulated in February. So just to kind of have that sense of disparity within the healthcare system, it serves to kind of understand a little bit why members are tired of constantly being asked to do more for less, and without getting the professional recognition that they deserve.
Yeah, so for our proposal for LPNs, it is that they be paid 84% of what an RN is paid, and that is consistent with their scope of practice and what they are allowed to do in the workplace, formally under the Health Professions Act. In many cases, LPNs and RNs are not distinguishable in the workplace. If an LPN calls in sick, an RN replaces them. If an RN calls in sick, an LPN replaces them. So the jobs are starting to look more and more the same. I'll give you an example. In Alberta, if an LPN is paid 67% of an RN's wage, in Manitoba, they're paid 81% of an RN's wage. So they're a lot closer than what Alberta is. The RNs right now in Alberta are the number one paid nurse in Canada, registered nurse in Canada. In Alberta, LPNs are in 7th place. So there's a long ways to go in terms of not only catching up with the rest of Canada, but also keeping pace with the registered nurse wage. And the 12% over 4 years just drives that gap even further apart than what it is now.
And then I know that obviously you mentioned many different professions under the union, but in terms of, I guess, being understaffed, is there sort of like a general number of how understaffed we are? Obviously, teachers said 3,000, and that's obviously not enough. But yeah, do you know, or a percentage of how many more people we would need to hire?
Well, I can tell you that the vacancy rate it hovers between 10 and 12%. So I would suggest that that's a minimum. At least that many people are needed to bring us up to adequate staffing levels. But that's really the only hard number I have, is that the employer who sets the staffing levels has determined that they should have 10% more, and they're not able to find them.
Yeah, not able to find them or unwilling to find them, because the issue behind short staffing has been an issue that has plagued our healthcare system for decades now. It was brought to a head during COVID, and even though everybody who works in the healthcare system has called for, or advocates for the healthcare system have called for, a human resource strategy that would actually deal with the short staffing, we have failed to see any movement in that issue.
And I had another question that's of a more technical nature, maybe, but I know that the healthcare aides are moving to be a regulated profession in February, and I wonder how, if at all, that is being negotiated at the table.
Yeah, that's correct. And they will be the only healthcare aides in Canada who are going to be licensed professionals. With licensing comes a requirement to have insurance and continuing professional development. It results in a fee that you have to pay to the licensing body every year. And ultimately, it results in a higher scope of practice. And that's what we saw with the LPNs is, their scope of practice didn't evolve overnight. It takes time. The government adds scope here, and then maybe a year later they add more, and that is what we are expecting to see with the healthcare aides. Healthcare aides can already do restricted activities, which I won't say it here, but if you look it up, you can see what it says. And so, that's important work that needs to be done. And regulation is a good thing. It's important, but it has to be compensated to make sure that folks are, have the money to pay for training and able to keep their skills up. So, it's great that they're going to be licensed professionals, but their scope of practice has to be recognized the same that it does for the LPNs.
Neil Prestovet, Radio-Canada. I have a question on the length of the potential strike. Would it be like an unlimited strike until you strike a deal, or 5-day strike, you go back to the table? How this work?
Our hope is that we are able to actually get a deal at the table. I think right now, with 98% support for a strike, the strike will depend on the willingness of the employer to actually come back with something that our members can accept. So, unknown.
And on the potential start date, you said November 17th?
November 17th is when we can actually legally, as per the Labor Relations Board hearing that we had, where we can serve notice to strike. That requires 72 hours, so the earliest that we can be on strike would be November the 20th.
Okay, that was my second question. Great, thank you.
Just for your records, I missed a local that represents the South Nursing Care, Local 41, which is Christine Bavrick and Catherine Siva Sanker. Yes. So they're also here and are part of the bargaining committee. Okay, again, thank you so much. Thank you so much for coming. I really, truly appreciate it. And I just wanted to leave you with the thought that AUP members are essential to Alberta Public's healthcare system. And when we stand up for fair treatment, we're standing up for the quality of services that all Albertans rely on. So we aren't just fighting for ourselves, but we're fighting for all Albertans, and we're fighting for the integrity of our public healthcare system. So thank you so much for coming today.